Hello everyone, I am Dr. Ziyad. Welcome to the AAPC CPC mock exam 2. In this mock exam, we will go through all 100 multiple choice questions organized by chapter, just like the real CPC exam. I will explain you how to find the answers easily and quickly. So make sure to subscribe my channel and check out my playlist. Chapter 3, Compliance and Regulatory. There are 3 MCQs. Question number 1. An advanced beneficiary notice ABN is used for A. To document a patient's consent for a surgical procedure, B. To inform patients about potential charges for services that may not be covered by Medicare, C. To request pre-authorization for a surgical procedure, D. To provide a detailed surgical report to the patient. So think the answer. The correct answer is B. Some services are not covered by Medicare in healthcare centers. The ABN is used to inform patients about potential out-of-pocket costs for these services. This ensures that they are aware of their financial responsibility. So the correct answer is B. ABN is used to inform patients about the potential charges for services that may not be covered by Medicare. Question number 2. How relative value units RVUs are significant in surgical services? A. They determine the geographic variations in the cost of surgery. B. They dictate the frequency of surgical audits. C. They provide guidelines for minimum necessary documentation. D. They measure the value of surgical services based on work, practice expenses, and malpractice. So, find the answer. The correct answer is D. That is, RVUs, they measure the value of surgical services based on work, practice expenses, and malpractice. So, the RVUs are a core component of Medicare physician fee schedules and are widely adopted by many commercial payers. RVUs are designed to reflect the resources typically required to provide a service. Each CPT code, including surgical code, is assigned RVUs across 3 main components. First one is physician work, represent the physician's effort, skill, time, and intensity required for a service for surgical services. This is a significant component reflecting the complexity of the procedure itself. Practice expense covers the non-physician costs of running a medical practice, such as rent, supplies, equipment, and clinical and administrative staff salaries. Malpractice accounts for cost of professional liability insurance. These RVUs are then adjusted by geographic practice cost indices and multiplied by conversion factor to determine the final payment amount for a service. Therefore, RVUs are fundamental to determine reimbursement for surgical services. Question number 3. A physician performs a rhinoplasty on a 2-year-old male with a nasal breathing problems. The child was born with a congenital cleft lip and palate with nasal deformity. Cleft and partial deformity was repaired when the boy was an infant, but the breathing problems have persisted and are a direct result of the congenital nasal deformity. Now the child can withstand a more intensive procedure. The surgeon performs the rhinoplasty to complete the correction of the deformity. What will likely happen with the processing of this claim? As long as they receive documentation of the procedure's medical necessity. So the first answer is A. Insurance will deny the claim as a cosmetic procedure. B. Insurance will pay for the claim as medically necessary. C. Insurance will initially deny the claim as medically necessary and then pay for the cosmetic procedure. D. Insurance will not process the claim. So find the answer. So here the correct answer is insurance will pay for the claim as medical necessary. During the processing of the claim, insurance likely pay for the claim as medically necessary, even though it is a rhinoplasty which can be done as a cosmetic procedure. In this case, it is considered medically necessary due to the fact that the child is experiencing breathing problems from the congenital deformity and needs a rhinoplasty to correct the problem. If the procedure was purely for cosmetic reasons, if the patient wanted simply to change the shape of the nose, then insurance would not pay for it as it would not be medically necessary. So here the correct answer is B. So there are 3 questions in the compliance and regulatory. So let's have a bonus question. What are medically unlikely edits, MUEs? A. Units of service edits created by CMS to lower the Medicare fee for service paid claims error rate. B. Codes that cannot be reported together because they are mutually exclusive of each other. C. Added codes that describe a service that can only be reported with another service listed as the primary code. D. Misuse of column 2 codes with column 1 codes. So please find the answer and leave your answer in the comment section. We can discuss the answer in the comments area. Please subscribe my channel and look at my playlist as well. Thank you.